Hey there, and welcome to this explainer. If you're currently navigating the complex world of fertility care, you're probably feeling, well, completely overwhelmed. There is a whole new vocabulary of medical jargon, super complex acronyms, and what feels like an absolutely endless list of procedures to wrap your head around. It is a lot to process, for sure. But today, we're going to act as your gentle, reassuring guide. We want to demystify one of those big, scary-sounding terms you might have seen jotted down on your doctor's notepad, the hysteroscopy. We'll explore exactly how it provides accurate uterine diagnosis and care, and hopefully give you some peace of mind along the way. So, first things first, what exactly is it? Look, it's totally natural to feel a sudden spike of anxiety whenever a doctor suggests a new procedure, right? Especially when it involves something as personal as your reproductive health. You might be sitting there wondering, is this going to hurt? What are they even looking for? Do I really actually need this? And let me just say, those are entirely valid questions. Take a deep breath. We're going to break down exactly what this is in plain, simple terms. Because once you understand the what and the why, we can replace all that anxiety with genuine empowerment. Okay, the word hysteroscope sounds like this incredibly intimidating piece of medical machinery. But honestly, it's simply a tool. In fact, it's just an incredibly thin, flexible tube. We're talking a few millimeters wide here, literally about the size of a single strand of spaghetti, and it's equipped with a tiny light and a camera right on the end. During the procedure, your doctor just gently inserts this little tube through the vagina to examine your cervix and the inside of your uterus. That is really it. It's essentially a way for your medical team to flip on the lights, so to speak, and get a clear, beautifully illuminated, direct look inside your womb. It gives them a view that other tests simply cannot provide. You can think of this procedure as a vital investigative tool. When you're struggling to conceive, or if you've experienced heartbreaking setbacks, you are desperately searching for answers. Sometimes standard tests give us some helpful clues, but they don't exactly give us the whole picture. A diagnostic hysteroscopy helps doctors find those missing pieces of the puzzle. It's used to carefully investigate any physical changes inside the uterus that might be acting as a barrier, literally getting in the way of your ability to achieve or maintain a successful pregnancy. Plus, doctors frequently use it to double-check and confirm the results of other, less direct tests you might have already gone through, like an HSG. Now, here is one of the absolute best, most reassuring aspects of this procedure. It can save you from having to make multiple stressful trips to the operating room. You'll probably hear two specific terms thrown around: diagnostic and operative. A diagnostic hysteroscopy is exactly what it sounds like. The doctor is simply taking a look around, diagnosing potential problems, or confirming past test results. But here's the real game changer. If your doctor does spot something abnormal while they're looking around, they can often transition instantly into an operative hysteroscopy. That means they can gently correct or remove the issue right then and there, all at the exact same time. Ultimately, the entire purpose of this procedure boils down to one beautiful goal: making the womb a welcoming space. You know, when we talk about fertility, we obviously talk a lot about embryos, but the environment where that embryo actually needs to grow is just as crucial. The goal here is evaluating your uterine cavity and safely restoring a typical healthy endometrial environment. We want to ensure that the space is perfectly prepared, wonderfully healthy, and totally ready for an embryo to safely implant and thrive for 9 full months. So what might actually be causing trouble in that environment? Well, sometimes physical obstacles inside the uterus act like unwanted roadblocks. Medically, these are known as extra growth-like lesions. This includes things like uterine fibroids or endometrial polyps, which, to put it simply, are just small, usually harmless growths of tissue. The doctor is also going to look for intrauterine adhesions, which is really just the fancy medical term for scar tissue. These lesions are known causes of infertility because they literally take up precious space and disrupt proper embryo implantation and growth. Now, you might be thinking, hold on, wouldn't my regular ultrasound have caught this? The truth is, standard transvaginal ultrasounds often completely miss these delicate, specific abnormalities. That direct visual access we talked about earlier, that's what makes the hysteroscopy so incredibly accurate. If you are currently navigating the really demanding road of IVF treatments, there is an incredibly bright light at the end of the tunnel here. Research actually shows that performing a diagnostic hysteroscopy prior to an IVF cycle can improve both your implantation chances and your overall success rate. By making sure the uterine environment is perfectly clear and receptive before transferring an embryo, you and your medical team are doing absolutely everything possible to maximize your chances of a beautiful, successful outcome. Now, I totally get it. Even after hearing all these amazing benefits, stepping into a clinic for any kind of procedure can still feel scary. It's a very vulnerable experience. But I want to really reassure you that a hysteroscopy is generally considered a very safe, incredibly routine procedure.
It has been proven time and time again as a definitive, trusted method to evaluate the uterine cavity. Doctors perform these all the time, and for the vast majority of women, it goes incredibly smoothly, just serving as a simple stepping stone toward their ultimate fertility goals.
However, to make sure you are fully informed and empowered, it's important to understand that just like any medical intervention, there is a small risk of complications. We want to carefully walk through these so you aren't caught off guard. The main, though very uncommon, risks include accidental damage to the womb or the cervix during the insertion of that little tube. There's also a slight risk of excessive bleeding during or after the procedure, or a potential infection of the womb. And finally, depending on whether you're asleep or awake for the procedure, there can sometimes be minor problems related to the anesthesia. Again, these complications are quite rare, but being fully aware of them allows you to have a really open, honest conversation with your healthcare provider.
When it really comes down to it, navigating infertility is all about gathering the right information so you can make the absolute best choices for your body. This procedure allows for the complete, accurate identification of intrauterine abnormalities that might be negatively affecting your ability to get pregnant. It quite literally takes the guesswork out of the equation. By accurately diagnosing any underlying issues, it empowers both you and your doctor to design the most effective, personalized plan of care moving forward.
And that brings us to the end of our explainer today. We've covered what a hysteroscopy actually is, how it spots and even fixes those hidden barriers, and why it can be such a huge beacon of hope for IVF success. I really hope this walkthrough has replaced any medical mystery with clarity, comfort, and a whole lot of confidence. So I'll leave you with this final thought. Now that you know exactly what's happening inside the room, what questions are you going to ask your doctor tomorrow to ensure your womb is the most welcoming space possible? Thank you so much for joining me, and I wish you all the hope and success in the world on your path forward. You've got this.